Vitamin C plus this, a powerful combination for managing diabetes. Many people view high blood sugar as an enemy, but the reality is more complex. Blood sugar is essential for life. Without it, we'd die. However, when blood sugar levels get too high, that's when problems arise. Doctors often warn that high blood sugar can damage your blood vessels and increase the risk of serious health issues like heart disease and nerve damage. For those with slightly elevated blood sugar levels, making some simple changes can help keep it in check. One powerful way to support healthy blood sugar levels is with a combination of vitamin C and other key nutrients. Vitamin C is not just good for your immune system, it's also a powerful antioxidant that can reduce oxidative damage. This is particularly important for people with diabetes, as they are more vulnerable to oxidative stress. That's why ensuring you get enough vitamin C is vital for managing blood sugar and preventing complications. But how do you incorporate vitamin C into your routine? One easy way is to take it in supplement form. A spoonful of vitamin C essence can provide the necessary amount to support your health. Many people love the taste, but be mindful when something tastes too good, it can be tempting to overeat. However, it's important to balance your intake of delicious foods with proper exercise. Unfortunately, modern conveniences like cars, elevators, and escalators have made it easier to skip physical activity. This lack of movement can contribute to weight gain, which in turn can cause blood sugar levels to rise. It's no secret that certain foods can spike blood sugar levels. For example, foods with a high glycemic index, GI, release sugar quickly into the bloodstream, causing a rapid rise in blood sugar. Foods like refined carbs, sugary snacks, and processed foods are prime culprits. On the other hand, foods with a lower GI, such as vegetables, whole grains, and lean proteins, help keep blood sugar levels stable. When it comes to understanding the impact of different foods on your blood sugar, the glycemic index, GI, is an essential tool. The GI measures how quickly blood sugar levels rise after eating a particular food. For example, while sweet potatoes may seem like a healthier option than regular potatoes because they're sweeter, they actually release sugar into the bloodstream more slowly, making them a better choice for stabilizing blood sugar. Understanding the GI of different foods can help you make more informed choices about what to eat. So, if you're concerned about your blood sugar levels or want to prevent diabetes, start by making smart food choices. Incorporate more foods with a low glycemic index, and be sure to include plenty of vitamin C in your diet to support your body's ability to manage blood sugar. And, of course, don't forget to stay active. Even small amounts of exercise can make a big difference. When it comes to managing blood sugar levels, understanding the glycemic index, GI, and the sugar content of foods is crucial. For example, potatoes score high on the GI scale, 95 points, meaning they can cause a rapid spike in blood sugar, similar to eating pure glucose. Sweet potatoes, on the other hand, score much lower, at less than 60, which means they release sugar into the bloodstream more slowly, making them a better option for controlling blood sugar levels. If you're concerned about managing or preventing diabetes, sweet potatoes are a much safer choice. They help keep blood sugar spikes in check, whereas potatoes can raise blood sugar quickly, putting you at risk for complications. But the story doesn't end with the GI score. While the GI is important, it's not the only factor to consider. For instance, while sweet potatoes may have a lower GI, they also contain more calories than regular potatoes. Sweet potatoes provide about 128 calories per 100 grams, while potatoes only have around 60. Even though potatoes cause blood sugar to rise faster, their lower calorie content might help with weight control, which is also essential for managing diabetes. The key takeaway here is that you can't just focus on the GI. It's important to consider both the GI and the total calorie content of foods. Eating more calorie-dense foods without balancing them with physical activity can lead to weight gain, which over time increases the risk of developing diabetes. But managing blood sugar isn't only about calories and the GI index. It's also about the overall nutrient composition of foods, including the sugar content. Certain foods have what's called the exponential downtrend index, meaning they cause a slower, steadier rise in blood sugar levels, which is ideal for anyone concerned about spikes. By incorporating these foods into your diet, you can maintain better control over your blood sugar levels. It's important to remember that blood sugar is vital to your health. It's the fuel your body needs for energy. While high blood sugar is dangerous and can lead to chronic diseases like diabetes, low blood sugar can also be harmful. Your blood sugar levels need to be balanced to provide the energy your body and brain need to function properly. The challenge is ensuring your blood sugar levels stay within a healthy range, as both extremes can cause problems. In the end, the key to maintaining good health is making informed food choices and understanding how they impact your blood sugar levels. By considering both the glycemic index and the calorie content of foods, and prioritizing foods that have a more gradual effect on blood sugar, you can manage your blood sugar and protect your long-term health. So, think carefully about what you eat. Your blood sugar levels depend on it. Diabetics often need to be mindful of the types of sugars they consume, as not all sugars impact blood sugar levels the same way. Understanding the different types of sugars and their effects on the body is key to managing diabetes. First, let's talk about sugars. There are two main categories: simple sugars and complex sugars. Simple sugars, like glucose and fructose, are digested quickly and provide an immediate source of energy. Complex sugars, on the other hand, break down into simple sugars during digestion, providing a more gradual release of energy. The most common form of sugar in the blood is glucose, which is what our body uses for energy. Fructose, another type of simple sugar, is found in fruits and is much sweeter than regular sugar, about 1.3 times sweeter. However, despite its sweetness, fructose has a low glycation index, GI. The glycation index measures how quickly a food causes blood sugar to rise, and fructose has a significantly lower GI than glucose. This means that fructose doesn't spike blood sugar as much as glucose does, which can be beneficial for people with diabetes. For diabetics, it's important to know which fruits are higher in glucose and which are higher in fructose. For example, watermelon is high in glucose. About 90% of its sugar content is glucose, which can cause a sharp increase in blood sugar levels. On the other hand, grapes are primarily made up of fructose, which has a much lower GI. Grapes contain only about 10% glucose and have a GI of 50, meaning they raise blood sugar more slowly and are easier on the body compared to watermelon. In general, fruits like apples, oranges, and strawberries are great options for diabetics, as they contain a balance of fructose and glucose and have a relatively low glycation index. These fruits won't spike blood sugar levels as dramatically as high glucose fruits like watermelon. However, even with fruits that are lower in glucose, portion control is still important. For example, while bananas can be a good option, they have a higher calorie count and should be eaten in moderation. When managing diabetes, it's not just about the glycemic index of foods, it's also about understanding the glycemic load, which takes into account both the GI and the portion size of the food. Even if a food has a low GI, eating it in large quantities can still raise blood sugar levels. In summary, it's important for diabetics to be aware of the sugar content in the foods they eat, especially when it comes to fruits. Foods high in fructose, like grapes, tend to raise blood sugar more slowly, while those high in glucose, like watermelon, can cause quick spikes. By understanding the glycemic index, glycemic load, and the types of sugars in different foods, diabetics can make smarter choices to help manage their blood sugar levels and maintain their health. Always remember, moderation is key. Too much of even the healthiest foods can have unintended effects. When it comes to diabetes, the most significant complications often involve damage to various vital organs due to long-term high blood sugar levels. These complications include kidney damage, damage to the retina, stroke, and heart attacks, all of which are primarily related to blood vessel issues. In fact, diabetes is essentially a vascular disease. Over time, typically 10 to 30 years, the blood vessels are exposed to oxidative stress, leading to gradual damage. One of the major problems is the blockage of blood vessels. The arteries that supply the heart are among the smallest in the body, and when they become blocked, it can lead to serious heart conditions. Similarly, even a slight blockage in the cerebral arteries can result in symptoms such as stroke. Diabetes-related arteriosclerosis can severely affect the kidneys over 20 to 30 years, leading to diabetic nephropathy, a condition where the blood vessels in the kidneys become so clogged that they can no longer function properly. In the eyes, diabetic retinopathy is a condition that occurs when the blood vessels in the retina become blocked. This can lead to vision problems and, if left untreated, may even result in blindness. Even when blood sugar levels are slightly elevated, the damage to the blood vessels can be significant, which is why managing blood sugar is critical. So, why is vitamin C often recommended for diabetics? Vitamin C is an antioxidant that helps neutralize oxidative stress in the body. Oxidative damage is a key factor in the deterioration of blood vessels, and by reducing this damage, vitamin C can help protect against complications like diabetic retinopathy, heart disease, and kidney damage. This is why diabetics need vitamin C more diligently. It acts as a safeguard for the blood vessels and can help reduce long-term complications. Vitamin C is particularly beneficial for blood vessels because it helps combat the effects of oxidative stress, which is a major contributor to blood vessel damage. Oxidative stress is caused by free radicals or active oxygen, which can stay in the body for extended periods and damage blood vessel linings, increasing the risk of plaque formation and atherosclerosis, hardening of the arteries. This process is worsened by high cholesterol, but it's not the cholesterol itself that causes the damage. It's the oxidized form of cholesterol that clings to the blood vessel walls, leading to blockages. When blood sugar is high, the amount of active oxygen in the body increases, contributing to faster oxidative damage. This explains why people with diabetes often face increased risks for vascular damage and why managing blood sugar is crucial in preventing further complications. In summary, diabetes is a disease that affects blood vessels over time, leading to complications such as heart disease, stroke, and kidney failure. Antioxidants like vitamin C play a crucial role in neutralizing oxidative damage and protecting the blood vessels, making it an essential nutrient for diabetics. By keeping oxidative stress in check and managing blood sugar levels, diabetics can reduce the risk of serious complications and improve their overall health. When it comes to diabetes, managing oxidative stress is crucial, and one of the best ways to do that is by consuming enough vitamin C. This powerful antioxidant helps neutralize the harmful effects of oxidative damage, protecting your blood vessels from wear and tear. By doing so, vitamin C not only prevents damage to your blood vessels but also boosts your overall health. It's like killing two birds with one stone, protecting your vessels while supporting your body's overall functioning. Overconsumption of food can lead to excess oxidative stress, especially if you're not taking in enough vitamin C. This is where the importance of this nutrient becomes even clearer. Without sufficient vitamin C, the body is vulnerable to oxidative damage, which accelerates aging and can make blood vessels less resilient. That's why, particularly for those with diabetes or high oxidative stress, vitamin C is essential. For diabetics, getting enough vitamin C is particularly important because it helps protect the body from further complications. The best approach for individuals with severe diabetes is to take vitamin C regularly, spread throughout the day. A common recommendation is to take it at each meal: breakfast, lunch, and dinner, to ensure a steady supply. This frequent intake helps maintain antioxidant protection and prevents a buildup of harmful oxidative stress. But for those who struggle to follow such a strict regimen, don't worry. It's better to start small, perhaps taking vitamin C 2 to 3 times a day, and building up from there. Consistency is key. Even for people with cancer or other serious health conditions, vitamin C can be a game changer. It helps improve energy levels, support the immune system, and fight oxidative stress, all of which are critical when managing chronic conditions like diabetes or cancer. Speaking of cancer, vitamin C has been recognized for its role in supporting cancer treatment. It's been shown to have a remarkable effect when combined with traditional cancer therapies. While it doesn't directly cure cancer, studies have indicated that it can enhance the effectiveness of treatments like chemotherapy by reducing oxidative damage and improving patient outcomes. It's been well documented that vitamin C specifically targets cancer cells without harming healthy cells, making it a vital part of cancer treatment strategies. The key takeaway for anyone managing diabetes or other chronic conditions is to understand the importance of regular vitamin C intake. It doesn't matter if you are taking it in large or small doses, as long as you are consistent and incorporate it into your daily routine. The typical recommendation for adults is about 2,200 milligrams of vitamin C daily, though this can vary based on individual health needs. When it comes to cancer patients, maintaining a consistent and disciplined approach to nutrition is vital. It's easy to overlook the importance of eating well, especially when feeling fatigued or unwell, but skipping meals or neglecting proper nourishment can have serious consequences. For cancer patients, it's critical to eat regularly and diligently to support the body's healing and immune functions. A key part of cancer treatment, particularly when using vitamin C, is ensuring the right concentration in the body. I've seen through experimentation how the effectiveness of cancer treatments, including vitamin C injections, relies heavily on concentration. At certain levels, around 10 millimeters, the concentration is high enough to have a cancer-killing effect. However, without reaching this optimal level, such as when taking vitamin C through food, the impact may be minimal. The difference between eating vitamin C and receiving it via injection is crucial. Injections deliver much higher concentrations, making them far more effective in targeting cancer cells directly. While oral intake can certainly support immune function and overall health, it's important to understand that it can't match the potency of a high-dose vitamin C shot. The body absorbs and utilizes the nutrients differently depending on the method of delivery. This highlights the importance of integrating both nutrition and medical treatments for cancer. For example, cancer patients should focus on boosting their immune system through diet, which plays a key role in digestion and energy production. But when it comes to cancer treatment itself, especially with substances like vitamin C, higher concentrations delivered through injections have proven to be more effective. The two methods complement each other, supporting overall health while also directly targeting the disease. In our clinic, we treat many cancer patients, often those who have reached the limits of what traditional treatments can offer. Many of these individuals come to us after exhausting all options at large hospitals. Some are in the terminal stages, seeking any potential solution to improve their quality of life. In these cases, it's critical to assess whether ongoing treatments are working, or if there's another avenue we can explore to provide relief. It's important to note that the timing of treatment can significantly affect outcomes. Cancer patients typically don't come to our clinic immediately after diagnosis. Instead, they usually come after they've gone through the primary treatments at larger hospitals, sometimes when conventional methods no longer seem effective. This delay in seeking alternative care can make treatment more challenging, but it also highlights the need for us to provide a comprehensive approach that supports them at this critical juncture. Our goal as medical professionals is to offer support where traditional treatments fall short, ensuring that cancer patients receive a well-rounded approach to care. For example, diagnostic tests can help us monitor progress, but it's equally important to observe how the body responds to different treatments over time. In our practice, we carefully monitor indicators such as tumor markers to track the effectiveness of treatments. These tests are not just for confirming the presence of cancer but for guiding us in making informed decisions about treatment adjustments. While markers can fluctuate, they help us understand whether a treatment is working or if we need to explore alternative options. Cancer care requires a multifaceted approach, and it's essential that patients understand the importance of nutrition, appropriate medical treatments, and ongoing monitoring. In the end, the goal is not just to treat the disease but to help the body fight back, improving quality of life and supporting recovery as much as possible. If cancer markers show an increase, it could be an early sign of cancer. There are a variety of cancer marker tests available, and they play an essential role in early detection. In many ways, taking these tests is a proactive step in identifying potential health issues before they become serious. I believe that regular screening is a valuable way to monitor your health. For those who think they are in good health, taking a cancer marker test at least once can be a worthwhile investment. The process is simple, doesn't require preparation, and can be done with minimal fear or anxiety. Health checkups are something many people already do, but cancer marker tests go beyond traditional screenings, helping to uncover potential issues early on. A lot of people go for routine health exams, and many are sent to specialized hospitals when certain results come back concerning. But the people who truly benefit are those who take action based on those results, whether they are completely healthy or not. Preventative care is the key to addressing health risks before they escalate. When it comes to cancer prevention, there are clear habits and lifestyle choices that can significantly reduce risk. Over the years, I've learned that certain rules can help minimize the likelihood of developing cancer, even if there's no way to completely eliminate all risks. For example, reducing salt intake can help prevent stomach cancer. Likewise, cutting back on fatty foods and red meat can decrease the risk of certain cancers, including breast cancer in women. It's essential to make these changes, but it's equally important to be aware of the early signs of cancer and to act quickly. That's why I always emphasize early diagnosis through screenings like endoscopies and cancer marker tests. These methods can identify cancer much earlier, which can drastically improve outcomes. The earlier we detect potential issues, the easier they are to treat. I personally get these tests more frequently than most, every 3 months, in fact. The results are often so clear and clean that I don't feel the need to undergo expensive checkups. Routine cancer screenings offer a sense of reassurance and can lead to early detection, which is crucial in preventing cancer from becoming a major health problem. To me, the best way to manage your health is through consistent early detection and preventative measures. When cancer is detected early, it doesn't have to be a terrifying disease. It becomes something manageable, something that can be treated effectively. The final piece of advice I would give is to always stay ahead of your health by taking preventive measures and testing regularly. It's the best way to safeguard your future.